This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D-HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning, happy Mother's Day, and welcome to our Mother's Day edition of Health Watch. Every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly FANTASIA, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. As always here on the program, we discuss the who, what, when, where, why, and how of Innovative Medical Associates, how they can help you and your family improve your overall quality of life. And if you have questions for Dr. Molly at any time during the course of the show, 855-839-1210 is our number here, 855-839-1210. That's the number here in the studio anytime during the course of the show. You feel free to call in and run by us what your medical challenge is or whatever happens to be. And good morning, Dr. Molly.
Hey, John, it's good to be back on this side, okay? I was in Palm Beach, for a conference where I'm really very interested in a particular instrument which I actually have secured for the office. It's going to be very interesting, and we're going to talk about that more to come. It's actually going to help me, and it's non-invasive. I'm going to be able to run this on my patients before we even do their first treatment and wait for the blood work to come back, and it's going to give me indicators as to where maybe the underlying problems are going on within their physiology, including things like the autonomic, including things like metabolism, these kinds of things. So I'm very excited about this, and I spent the day hawking this thing with one of the guys who actually helped develop this thing. And it's all done by AI, which means that it takes the bias out of the healthcare providers' mindset. So, like, sometimes people come in and they're I always hear the doctor thinks I'm nuts. Well, this kind of instrument can put that to rest because it can really pinpoint where we see dysregulation. Can you imagine? And it's not the healthcare provider doing that, but it's actually the artificial intelligence taking all the analytes, compressing them in 7 minutes, and giving the healthcare provider, hey, this patient may not be crazy. Okay.
And you've heard that a million times.
I see. Right up till Friday, I saw it. So believe me, that's why I have an interest in this kind of stuff.
And you did that last week. And when this thing happens,
it's going to happen. Don't you worry. We're going to talk a lot about it.
We're going to talk about that. But let's talk about Innovative Medical Associates and what you do on a regular basis.
Well, as you know, we're a group of like-minded providers, and they all work out of our licensed primary care facility. However, we can do anything that any other primary care facility can do. If you need a prescription, we can write the prescription. I can't tell you how many radiology studies we've done in the last few weeks because of my out-of-town patients. I've done so many, it's too numerous to count. So believe me, we can do all that for you. We can write prescriptions. We can send you out for additional blood work. We can do all of that. In fact, we even have one of the major labs right in our facility we're sending out for so much data. But that really is just one part of what we do. Our philosophy is what really separates us from most primary care facilities, in that we want to use the least amount of pharmaceutical intervention possible to help effectuate the change you need, keep you safe, and reduce the side effects.
And with prescription medicine, there are many side effects.
Sure, and we're not saying get rid of your prescriptions. What we're saying is maybe, just maybe, we can help you get rid of some. And if there's another way to approach this in a more naturopathic way, that's what we do. We're all about your functionality.
Do you have as many side effects with the nutraceuticals or the
Sure.
non-prescription meds? Do you have any?
You can have side effects. I mean, and they can interfere with the present pharmaceuticals you're on. So, of course, it's very, very important that before you start looking at what natural products can help you, you want to make sure that you're in a place like ours where you have the ability to say, oh, well, we can start this patient on this particular vitamin, this particular herbal, and not interfere with his present pharmaceuticals and actually help him get off of those.
Your philosophy is the least amount, as
Sure.
you said, of pharmaceuticals. And a friend of mine called me, and he heard the commercial that I do for you.
Oh, yeah, sure.
And he said, I'm wondering about that. Does it work?
Does it work?
And
Yeah. Here's the
he called
thing.
me specifically to say, does that work?
Yeah, well, did you tell him you're a patient?
Yeah,
too?
I told him
good,
that. I said I
good.
get it twice a week.
Okay, so bottom line is, yes, it works. Here's the thing. There is such a thing in medicine called tincture of time. They may not work as quickly on the quote-unquote problem as a pill will. You take your pill, you have a headache, it's gone. So do I, many times. That's
Yes,
what you're thinking.
yes.
Okay, well, it could be that the natural product might have to take an extra hour, okay? But guess what? It may in the long run be better for you because you won't have the side effects of whatever else you're taking. And if we can cut some of those, and again, I don't promise that we can cut all of them, but lots of my people come in with bagfuls of pharmaceuticals, not just natural products, pharmaceuticals. How's about, don't you think there's some interaction between the pharmaceuticals?
Yes.
Of course.
Definitely.
And many times it's amazing when the doc and I go through these and we go through them with the patient and our wonderful nurses, we're able to really look at this and say, look, we can get you off these three. Here's how we do it. Slowly, methodically, and get it done so that you're not in harm's way.
You gave me something a couple of weeks ago, and it was discovered that I'm slightly anemic.
Oh, yes.
And you said, here's what you do. And you gave me a pill that is
Well, it's an iron pill.
Iron pill.
Yeah.
But it's a
pharmaceutical. It's not a pharmaceutical.
Not a pharmaceutical.
No,
That's what I meant.
And it's not a pharmaceutical, and it's made up of a particular formulary that doesn't upset your digestive tract. Everybody I've ever put on the old-time iron stuff, always had GI problems after they took it. I told you weren't going to have the side effects that people have from these manufactured iron. And
I didn't.
No, this is a European thing. I'm very big on some of the Italian products that are out there that can really help people.
And that's just one example.
Oh, right. And again, that was an oral. We deliver iron. By the way, we deliver iron in hydration.
Yes.
We can do that. And we have. I have a whole series of patients who are coming in who are referred to us from physicians who are GI and also from GYN physicians who have low iron and they need the infusion. And we may augment with the thing I gave you, which is actually the tablet I gave you.
Hydration is the cornerstone
bet.
of your practice.
You bet.
Talk about how that's done and why it's done and how effective it can be.
Well, first of all, hydration has been a medical process from the get-go for a long time, John. It's been around. The minute you go into the ER, they put a cannula in and they're getting ready to give you an IV. People are grossly dehydrated, I will tell you, in this, at least in people who come into my practice, generally are grossly dehydrated, and that in itself is a condition that has to be rectified. But the reason why fundamentally use the hydration is because it allows me to give a patient a proper amount of the natural product in a proper amount for that patient for the condition and to effectuate the change, get the job done in a relatively quick manner.
And how many times would you have to come? I mean, I've heard, there was one patient was there every day.
Oh, yeah.
And I'm there twice a week.
Right.
And
well, it's interesting. I had a wife who brought her husband in who said the doctor told him he has a touch of prostate cancer. What the heck that was, I don't know. But they were just going to watchful wait on it. So I reviewed some of the things. I brought it into Dr. Cassigan. I said, look at this. The guy has some cells that he got out in the needle biopsy. They couldn't do an actual tissue biopsy. So it was in there. I said, well, don't you think this guy could really have some improvement if he did a short course of what we do and then go down to once a month? And a short course might be 5 treatments. She and I agreed. We are starting him next week, and then he's going down to once a month after that. And believe me, we will watch that PSA for him, probably much more readily than his urologist will, because we have the time to do it.
So there's really no formula.
Right.
It depends on the patient.
Right. And I tell you, listen, as somebody who had a serious challenge in starting this, John, I love when they tell you, oh, well, we can wait on this. It's not that bad. You just have a touch of something, like a touch of diabetes that they told you had.
Yeah.
You don't have a touch of some of these things.
You have diabetes, so you don't.
Right. You got to get yourself together, and you got to get in and get yourself straightened out, because there are other things that can happen. You want to stay on top of your own body. Be your own advocate, people.
And how do you advise patients to stay on top of their own body?
Well, I advise them that, believe me, go to your specialist. If they make an appointment for once every 3 months, make sure you show up. But I also say, let's be in tune. If you think you're having changes or whatever, let our docs know. And maybe we'll send you out for a specialist, or send you back to your primary and say, why aren't you looking at this problem, that problem, this symptom? We really have to be on top of that. And today we'll talk a little more about some things that affect women.
Speaking of women, we are going to talk later on in the show about women and coronary artery disease. But I wanted to ask you, in terms of particular challenges that people have, is there one challenge that works best for you in terms of dealing with it, or
no? Well,
how does that work?
We've cut our teeth on coronary artery disease, and lately I would tell you that now I have statistics for post-COVID, post-Lyme, and I'm seeing so much of the Lyme disease, so much of the environmental conditions now, as well, of course, cancer. Cancer's everywhere. I mean, it's unbelievable, John. You see it.
I know, and I really, if you're having a bad day and you come into your facility and you see some of the people who have cancer who are,
right,
then you say to yourself, hey, I'm not that bad.
No, not only that, but you come in about 3 weeks later and you start looking at them and they're starting to look better.
That's right.
And my job is not to cure the cancer. We don't cure anything. But do we improve our cancer patients' quality of life? There is no doubt we do. Whether they're doing conventional treatment and or no treatment at all, I would say we do a really good job.
Is cancer one of the categories that you have kind of perfected in terms of your treatments?
Cancer support, I would say yes, definitely, because I'm very cognizant. My physicians are very cognizant of what we shouldn't do for someone who's getting chemotherapeutics or radiation, what not to do while they're getting it, and still help them maintain their quality of life. Because man, when you're going through a lot of the conventional treatments, that rage is
pretty tough.
Yeah, it's pretty tough. And it can really ravage the body while you're going through it. And so we want to keep you in good shape to get you through this. And of course, I consult with an oncologist as well. So here we have a situation where what we need to do is maintain whatever quality a patient has, optimum for where they are in their cancer journey.
We are coming up on our first break of the morning. The show is called Health Watch. It is here every Sunday, 8 till 9. Talk Radio 1210. WPHT is the place. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Do you have a question for Dr. Molly? Do you have a medical challenge you want to run by her? Feel free to call us now at 855-839-1210. That is the number here in the studio, 855-839-1210. Again, Health Watch, Sundays 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly and I return with more of today's Health Watch after these words. We are back here on Health Watch, and operators are standing by right now at Innovative Medical Associates. And the number, 856-489-0505. Again, that's 856-489-0505. And when you call, that's really the number to really get your initial consultation started. And it is complimentary. And it's just a way to get started with the process. 856-489-0505. That's the number. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. And the show is Health Watch here, Sundays 8 till 9, Talk Radio 1210 WPHT. If you want to talk to Dr. Molly right now, 855-839-1210. That's the number here in the studio, 855-839-1210. We are going to talk about women and coronary artery disease just in time for Mother's Day.
Exactly. It's very important. You know, women, we're very complex creatures. That's why for years and years, when all the new drugs came out, they really weren't testing them on women. Most of the studies were set up to just test on men, on male patients. And so as time progressed, the powers to be, including Big Pharma, realized, you know what, they better start testing on a pool of women because the metabolics are different, and therefore, you know, you better look at these particular drugs as they relate to women, not just men, and say, oh, this is the data that we got. So the data for a lot of the older drugs was done only on male patients. So could you imagine that some of that data was screwed up, right, for women?
Sure was.
Of course. And so that being said, coronary artery disease affects women differently. And one of the things I want to say is that we're finding right now 80% of women ages 40 to 60, and believe it or not, you can see this on PubMed, have one or more risk factors for coronary artery diseases.
Which are?
Which can be hormonal. It can be the fact that for women, it seems that the coronary artery disease can be much more related to the microvascularization of the arteries. In other words, they have more inflammation in the endothelial, which is that lining I always talk about, which is harder to treat. And also, it's also hard. You can miss it. And sometimes women's just the overall things that we usually associate with men and coronary artery disease, like shortness of breath, the pain. The pain is different in women when they're having cardiac issues. Sometimes it can even be mistaken chronic fatigue. Chronic fatigue. Women tend to have more fatigue than men, and people just poo-poo it, but maybe the heart isn't pumping as well. So these are things you have to look at differently, right? The nausea, digestive disorders may be related to coronary artery disease for women. Isn't that interesting?
Yeah.
Right? So you have to look at these things and say, okay, you need to have a good physical, and you need to have someone who's really interested in heart disease as it relates to women's and women's health. So we all know the traditional stuff, okay? You know the pain. You know weakness in arms and legs. You know the numbness. You know those things are pointing to inflammation. But not always the microinflammation that many, many women suffer from. We also have to realize that there's a hormonal component, and herein lies a real Goldilocks thing, because before menopause, estrogen provides women with some protection against heart disease, right? Then after menopause, it causes women, if you have too much estrogen, if you're on birth control pills, or they put you on estrogens to stop the hot flashes, that can then relate to more coronary artery disease. So here's what I say. This is the kind of thing you have to realize. If you experience early menopause, like after hysterectomy, you're more likely to develop heart disease compared to women of the same age who haven't. So they're just statistics. The bottom line is, again, I'm going to tell women, pay attention to your own body. To pay attention.
Isn't it true that cardiac disease is the number one killer in women?
Yeah, it ranks up there. I think it may fall into number 2 after
but
breast
it's up
cancer.
there.
It's up there. It doesn't matter 1 or 2, right? And so what we have to do is look at all these things and say, okay, how can we prevent some of this? What should we be doing? Everyone knows lifestyle, right? We know exercise, not too much, not too little. I believe in walking a great deal. You know that. Certainly you want to do balance exercises. You need to make sure your bones are strong, all of those things, right? Actually, an interesting thing, Frank, our favorite patient, called me this week and asked me, or didn't get to me because I was so busy, but did get to Barbara, our wonderful Barbara, and said, I don't think Molly knows about this person on PBS, I guess TV, public television, TV or PBS. And indeed I did, and she's a big proponent of eating naturally and eating vegetarian. And actually I knew her from way back, and went back in the day when I really was interested in microbiotic diet. So diet can play a part. The reason why I'm mentioning it, diet can play a part. You want to limit your meats, those kinds of things. The same kind of things we would tell men, only I want women to realize it in spades. Okay?
Do women have to be more careful?
Well, I think women, I think women do, because, again, they present so differently. In other words, women walk around and they may think first of all, the pain tolerance level is different, and they may not present with this crushing pain in the chest, but more likely to present with something down the arms or just whatever. And also the digestive thing. You might present with nausea, that kind of thing, and not put it together that it's really cardiac. So I would say yes to your question. So the thing is, we have cardiac programs, but the cornerstone for all of these programs, John, are what? Reducing inflammation. And how do I do that, John? Hydration.
Hydration.
Right.
Speaking of Frank, he is on the line. Frank, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Frank.
I heard Dr. Molly call my name. I got called in.
No, listen. I wanted you to know, of course I knew about Christine. Of course I did. And I knew her way back when she started the program, Christine Cooks. And actually, I really did a course with somebody who promoted her type of cooking, etc. So I thought it was pretty funny when you called, and Barbara started laughing because she said, yeah, of course you know who that is. But I find it interesting. She's making a comeback. She was pretty popular back in the early 90s and late 90s, but she's coming back, so it's a good thing.
Hey, Dr. Molly, I'm calling about something a little bit different, but I did... A friend of mine found her phone number. I talked to her husband. I think it's Rob or Bob Perillo.
Mm-hmm.
Christine is in Italy right now doing shows right now. She's in Italy.
Yes, of course.
Anyway, I do have a question for you, but I do have some terrible news, but I'll save that for after the question. And I want to break your heart right now.
Oh, my God.
Holistic, I was asking Alexa, so I couldn't try to find Christina information about her. Does that really work, just eating vegan and everything? Mm-hmm. Two places. What is quantum alignment? One place does quantum alignment and not reggae, that Japanese thing, Reiki, whatever.
Reiki. Yeah, Reiki. Listen, that's all energy work. It all has to do with energetics. And now I'm not an expert in quantum alignment. I'm not. I understand energy work. I believe in energy work. One thing I know about Reiki, it is a nursing practice. If a nurse is doing the Reiki, they do it extremely well. One of my nurses at our facility is a Reiki master, and we use it actually for mindfulness, like for putting people in a more relaxed state, that kind of thing. But I'm not sure I would call that, I don't want to say that it cures anything, and I hope that they're not advertising that these two philosophies are curing someone's challenge. You'll hear me very clearly say, I don't cure anybody, we just want to improve quality of life. Energy medicine. Okay. Energy medicine is very important because, as I said earlier in the show, autonomically we do have a lot of energetic movement in our body. I'm talking about metabolically, etc. So, Frank, I'm not an expert in those. People use them. As I said, my nurse is a Reiki master. She does a very good job. I think, John, you did a mindful meditation with her.
Yes,
did
I
you
did.
not?
Yes.
It is very helpful, Frank.
It is helpful.
It's helpful.
Yes.
That I can address. That I can speak to. Now, give me the bad news, brother.
I've known you for a long time, Dr. Molly. I love you. I've been with you probably for 15, 20 years on the radio. I've been your patient and everything. You're wonderful. I hate to break your heart. Maybe it won't break your heart. But last week I cheated on you.
Oh,
I
that's
had
all right.
John on from 9 to 12 on Saturday morning, okay?
Oh, God, no, that's all right.
I think that was so good. I did it yesterday, too.
Wow, I got to tell you that now. See, now it doesn't break my heart, and I'm glad that you had the energy to have him on 9 to 12, and I'm glad you called the office, and I'm actually glad you called the office about Christine, but because it's good to know what's out there and who to listen to, and I definitely like her style. I myself, though, I got to tell the truth. I myself am not a vegan. And a lot of my patients are not vegan, but my philosophy. I believe in Goldilocks, not too much meat, not too little, not meaning proteins. Get your proteins from other sources, but I think it's not a bad way to live, honestly.
Hey, Dr. Molly, you said it before, and I agree 100%. You have the smartest audience out there, and for all the mothers listening, happy Mother's Day, everyone. Respect your mother today and every day.
Yeah.
And also, Dr. Molly, John is the Hugh Hefner of talk radio. He's a playboy, right?
Oh, yeah, he's a playboy.
He
Absolutely.
gets people on Sunday and people on Saturday. He's everywhere.
And not only that, hey, the idea is we want to keep him a playboy well into his 90s, okay? That's the
I love
idea.
his show.
I do,
Gilly,
too.
Dr. Molly, but I love his show, too.
God bless you, Frank. All right,
thank you,
have a
Frank.
great day, honey. Have a great day.
Have a great day, yeah.
Give my best to your mom.
Right. We are coming up on the halfway point of the show. Boy, it's flying by as always here. Health Watch is the program, Sundays 8 till 9, Talk Radio 1210, WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210. That's the number here in the studio. 855-839-1210. We are coming back with more of today's edition of Health Watch right after these words.
This program is paid for by Innovative Medical Associates.
We are back here on Health Watch. And again, the number to call, operator standing by right now at Innovative Medical Associates, 856-489-0505. 856-489-0505. When you call, you want to set up the initial consultation with Dr. Molly. It is complimentary, and you really learn a lot about what she can do for you, what the facility can do for you, and how they can help you overall with your quality of life and improving it. 856-489-0505 is the number. And you want to check out the website because there's a lot of good information on there as well. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com. That's the website. It is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Let's go to the phones. John is in Mount Laurel. John, good morning.
Hey,
welcome.
John, how are you?
Good morning, Dr. Molly. Good morning, John.
Morning.
Listen, you don't need that machine, Dr. Molly. You don't. You just cancel the order. Because I was talking to a young fella that came to you.
Yeah.
I was talking to him about 3-4 weeks ago. I talked to him several times.
Right.
But anyway, that guy was carried into your place. Couldn't even walk.
Yeah, I remember.
Skin and bone. And
Yeah.
and the last time I talked to him, just before he left, he had gained 21 pounds. He felt
Yes,
wonderful.
he did. Yes, he did.
Was to multiple. He told me he was to multiple emergency cares, to quick care, the doctors, the hospitals.
Yeah.
Nobody knew nothing. He comes to you. You do 2 blood tests, and he said the doctor wanted to know how you knew to do those blood tests. That's what he told me.
Yeah, I know.
You don't need any machine. And the guy became 21 pounds.
Yes, he
looked
did.
Fantastic 2 weeks ago when last time I saw him.
And let me tell you, John, he's doing great. He's working back.
Yeah.
He started working full time, and he's
good
just,
for him.
I'm speaking to him a couple of days a week. Obviously I want to follow up, right?
Right.
And it's
Well, he
like
said he's coming back.
Oh, yeah, he has to
for
come.
tune-up and, yeah.
That's exactly right.
Yeah.
Everybody needs the tune-up. But you're right. That
Right.
is a case that it baffled a lot of people. But look, I love anything that's technologically that can help us help a patient. That's all. I mean, I'm all about it. And I love to have data so that I can show, they can go back to their regular doctor and say, hey, look at this, look at that. We're not saying that, this takes the place of good old-fashioned sleuthing in terms of looking at your medical records or anything, but it's just another tool in the toolbox. And, I helped with the AI, so it's a good deal.
The regular doctor does not have time to do what you did.
Exactly.
10 minutes in, 10 minutes out.
That's right.
Exactly
all
right.
Contract.
It's that.
It's just a shame.
Exactly
it's
right. And it's a bite, John. It's a bite. Right now I have one of my good
even
people.
Myself, look, I mean, when I came to you, I was skin and bone. I couldn't even talk, if you remember. I talk like, rah, rah, rah,
I remember.
My voice shot. It was, and my God, you straightened me out. Matter of fact, I still haven't had anything to do with allergies in almost 6 years now.
God bless.
And I was on shots when I came to you.
Listen to me. We got to thank the big physician upstairs for all of that. Everything's in God's hands. That's right.
Every day.
And I do too. Yeah. I name all you guys. You're all on the prayer list.
John,
God bless everyone.
Thanks for the input.
Thank you,
for the
John.
call.
Thank you. God
Appreciate
bless.
it.
God bless.
I remember the patient he was referring to.
Lester.
I mean, he was ready to. He was ready to check out of the hotel.
You got that right.
He really was.
You got that right.
I mean,
gosh.
Amazing story.
Okay.
Gary is an LBI.
Hey,
Gary, good morning. Welcome.
Hi, Gary.
Good morning, Doctor. Good morning, Dr. Molly and John. Look what the cat brought in. We're back up again.
Good.
Hey, I'm glad to hear that.
We'll be seeing you soon, huh?
Hey, listen, maybe you can come in with our old friend Father, right?
I hope so. We're on the way to Mass right now, and I was just thinking about you, and I just wanted to say thank you for all these years taking care of us in all these different situations that have arrived. I mean, we're still healthy as a clock, and everything's going well, but we can't wait to get back in to keep it that way.
Well, we want you to get it back in and keep it that way. It's good to hear your
voice.
It's nice to hear yours too, Gary, and I'm glad you're up here. But you left some beautiful weather in Florida just right now to come into this.
No. It was almost 100 when we left.
Oh my gosh, really?
And it was 49 last night on Long Beach Island. So I don't know. I should have stayed in Tennessee.
I don't know. Yeah. You know why? When I was down last week, it was like in the 80s. It was beautiful. I was in Palm Beach, so it was gorgeous.
Tampa was really hot for some reason, they said, and I said, I'm glad we got out. But I have a question for you, Dr. Molly.
Sure.
Maybe you can help one of our friends. One of our friends has a lot of, what is it, Jen? Vertigo.
Oh,
and she's
wow.
troubled with it a lot, and she sometimes can't even drive, has to put her head down, and I've heard it more and more lately. Is there anything can be done with vertigo?
Oh, yes. There's a couple of things. First of all, she really needs to be checked out well, too. We got to make sure she's getting enough blood flow to the brain, and that she doesn't have any kind of inflammation there. She needs to see... she needs to come in and talk. I would love to talk to her. But secondly, there are many things that can help. In fact, one of the things I would probably look at, I want to look at all of her blood work because she could also have an anemia. Even she may have the blood flow, but she may not have enough red blood cells to carry the oxygen up there. So these are a couple of things that should be looked at just off the top of my head. But if she has any blood work recently or doesn't have any, she ought to come in and see us, really. And we also need to look. No worries. And I'm glad you're feeling better because I spoke to you. Weren't so good down there. God bless.
Yeah.
I'm glad. Thank God.
A lot better.
Thank God. Thank you, buddy.
Thank you very much. I'll
Take care. Love the gym.
We'll see you, right, Gary?
Yeah,
see you soon.
Nice.
Nice
call.
Good call.
Yeah.
So back to the women's health and cardiac issues.
So as I said many times, we know about the buildup of plaque. We always hear when men have problems with coronary artery disease, they always talk about the widowmaker. Well, women, of course, have coronary artery disease too, but sometimes theirs is a little more obscure. As I was saying, you can see a lot more of the microinflammation for women, and that, my dear, is very, very important. because there are things we can do in the hydration therapy to help this. First of all, John, we're going to use what? Our anti-inflammatories, vitamin C being one of them. In cardiac patients, I try to use maybe some vitamin C that might be extracted from tapioca. And then again, I might even use some other things. I would do some B vitamins. You really need to look at the folate acid for women. Very, very important. I would run hormonal levels because, again, the estrogen has an effect on the coronary artery in that it may work strengthening the endothelial. So we want to look at it, but too much is not good. People know this. So things have to be done in balance. I would look at turmeric for women. We use turmeric in our IVs. Grapeseed extract is another one that might be in a coronary artery disease drip for a particular woman patient. So piperine, of course, extracted from pepper. Coenzyme Q10, men and women. You know I'm a big believer in coenzyme Q10.
I take it every day.
Yeah, men, you better, because we lose so much of it, and we need so much of it for cellular energy, and that includes the cardiac. How about some herbal stuff? We have an extract of hawthorn. Hawthorn is excellent for coronary artery disease. In particular, hawthorn is very good for women who are suffering from congestive heart failure. There's a lot of data to support that. Ginger's another one. Arginine is good for both men and women for blood pressure. You hear me talk
I take
about
that too.
I know you do, and I'm glad you do. How about magnesium? Magnesium, we know, works. The idea is you want to use it just right, because too much magnesium isn't good. But I use something for AFib, and women suffer from AFib a lot more. Elevated levels of homocysteine. You know I test for that in both men and women, but we see more of that in women. Choline is a nutrient that we use for AFib, and I will tell you, it's very important because it works for the methylation that women need and neurotransmitters, which tends to tell the heart what to do. Remember, your heart never stops. When it stops, you're in trouble.
That's right.
You want your heart providing this, right? So you really need to worry about stroke, not just heart disease, so to speak, but stroke and all the associated issues that can happen, the infarcts, these kinds of things. Coronary artery disease in women is something that women should be taking seriously. It's not just the narrowing of the arteries, like I said before, but it's the inflammation on the vascular walls that is much more difficult to treat, and also to put your finger on again.
We are coming up on our final break of the morning. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210. WPHT. 855-839-1210 is the number here in the studio. We still have time to take a couple of your calls. If you have you want to talk to Dr. Molly, a question, or you have a medical challenge you want to run by her, 855-839-1210. The show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. I'm your host, John DeMasi, with Dr. Molly, and we will return with more of the show after these words. We are back here on Health Watch, and again, operators are standing by, and they will be there well after we leave you at 9 o'clock this morning here. So give them a call now, or you can call them later, but call 856-489-0505. That's the number, 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And a quick reminder, if you missed any of today's show, or if you liked it so much you want to hear it again, this afternoon at 4, it's our Health Watch replay, 4 to 5, right here on Talk Radio 1210 WPHT. A couple of minutes left of the show. Want to jump in here with a question, 855-839-1210, our number here in the studio. We're just kind of wrapping up this discussion of women and coronary artery disease.
So, John, I guess I want to leave people with some understanding. The factors that I think are most important that women should be in tune with their body is anemia, especially if you've had anemia after pregnancy or during pregnancy. early menopause. If you had a menopause that was surgically related before the age of 40, and you need to be aware. Endometriosis. I can't tell you how many women have endometriosis and also then tend to have some of the other risk factors for coronary artery disease. High blood pressure after the age of 65. History of problems during pregnancy. That is gestational diabetes. We've all heard about that. Also high blood pressure during pregnancy and giving birth to the baby who's maybe premature or smaller than average. Hormonal birth control. I want every woman to be aware of the estrogens in the birth control patches, etc. Autoimmune and inflammatory disorders. Women tend to have more of those, and we have to be aware that they can contribute to some cardiac problems. Mental health problems, and I don't mean women are nuts. I'm saying, look, guys, depression and anxiety, everyone knows that you don't go through life just carefree, hopping through the garden. We all have it. We have to learn to deal with it. And Frank made a good point. Reiki's a way to do it. Mindfulness, meditation, metabolic syndromes, right? That's the group of things, including diabetes and pre-diabetes, all of these things. And of course, our problems with keeping our weight under control. Women tend to have more problems because of the hormonal things. Those, I would say, are the biggies, and they're the ones women should be watching for.
And you do want to give us an update on some patients.
I think actually, I thought John gave us a good one. I sent that young man home, and he's doing well. He's working. He's doing great. He put the weight on. He's working. His father and mother were so happy, and his wife were so happy because he's actually working 5 days a week. That is unbelievable because he does construction. That's number one. A couple of updates. I had a patient who's being treated, for the breast cancer, and she did some radiation in the past few weeks. She was feeling terrible. She was able to come back to me because the timing had gone by where it was safe for us to do some more anti-inflammatories, etc. She called back Friday and said, I'm feeling better than I have in the last 3 weeks. So they're wins for me with the cancer patients.
And you've had a lot of wins.
Well, small wins, I would say, are important. And of course, I have my wonderful patient. We all know Pam, who's been with me all these years. And, she's doing great. And she did no conventional treatment. And I pray every day. And a good friend of hers who comes in, who we worked with, she also got a clean bill of health from her oncologist this past week.
So you've had a lot of success.
I've had a lot of success, and I give it all to the good Lord, because that's who we have to call on, the big doctor.
The physician in the sky, as
Amen.
You say.
Amen. Amen.
A question back to women and coronary artery disease. Has COVID affected?
Oh, yes. Don't say no more. Post-COVID, I'm seeing so many of the cardiac inflammatory issues, like the myocarditis, viruses that affected the heart, right? And put people in what is similar to congestive heart failure. And I got to tell you, that's been a big one, both for men and women, but more women have been affected in the coronary, the myocarditis than men patients, at least in my clinic alone.
So inflammation has increased.
Oh, my gosh.
Since
post-COVID. Absolutely. And I think we don't even know the half of it yet. How do you like that?
Oh, say no more, because
yeah, it's tough.
Is there any other patients?
Well,
that
I think a couple. I have several new patients coming in this week. I'm handling several people with depression. Oh, my lung patient who had both the Pseudomonas and Candida. She's a 60-year-old woman who came in from out of town. She's doing extremely well. I think she's going to be able to be discharged in the next 2 weeks. Right now, we're just dealing with her chronic cough, which is related to COPD, because she worked in a varnish shop. So it's an environmental. She had an environmental underlying condition, and it just made the lungs ripe for taking in these particular bacteria and this candida. But that was was pretty virulent while going through this. But I think at this point she's negative in blood cultures and the sputum cultures, and we're moving forward with her.
So it's kind of it's all over the place.
We run the gamut. We run
really...
the gamut. Well, I'm telling you, we have the depression patient is coming back for his tune-up. He was doing extremely well. I want to see if we can use a new type of a subclinical dose of a particular pharmaceutical for him to really help him maintain his upbeat nature that he's gotten right now. We want to make sure he maintains this. But again, John, a lot of this, remember, people have to continue to do some things on their own. I mean, this isn't holy water, like I say all the time. You know, I need you guys to help in your care. You can't just be cavalier about it. If we put you on a vitamin regimen or a natural regimen along with your pharmaceuticals, I expect you to take it the way we help you do it.
And I want to shout out to your nurse, Vicky, because a couple of weeks ago,
she was great.
She did the Reiki.
Oh, it's great, isn't it?
You want to know what she told me?
What?
She said, "Do you have a back problem?"
Yeah, she picked it up energetically.
She picked it up.
Yeah,
and it was amazing.
And that's what when Frank was talking about these energetic particular protocols. People become experts in the particular protocol. I am not an expert in that, but I believe that it can be helpful. I don't think it can take the place of nutrition. I don't think that, but I do think it can work hand in hand, which is why I like Vicky.
Right,
she's the best. By the way, she's very, very good at it.
Okay, that's going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now, and they will be there well after we leave you at 9:00. 856-489-0505. That's the number. 856-489-0505. Don't forget to check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show, you want to hear it again, 4 to 5 this afternoon, the Health Watch replay here on Talk Radio 1210 WPH.D. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, Jess, Vicky, and Daniel. And then, of course, there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening. We'll do it all over again next Sunday. Health Watch, 8 till 9 here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.